This is the Daily Medical News by MD Edge, where we bring you the latest 4 stories in medicine, followed by a closer look at the day's top story, straight to your earbuds, smart speaker, or your commute. If you want to learn more about any of these stories, there are links to the complete stories in the podcast notes. Today is Monday, September 23rd. I'm the voice of MD Edge podcast, Nick Andrews. Today, we'll take a deeper dive into the first data from the Verify trial that appeared to show the value of early combination therapy in type 2 diabetes. But before we get into the news, a few announcements about what's happening at MD Edge Podcast this week. In Blood and Cancer, the official podcast of MD Edge Hematology Oncology, Dr. Alana Yurkowitz leads a conversation with our team of Hem-Onc trainees who have been behind our show notes this whole time. And this week in the Post-Call podcast, the interview is with Dr. Emily Silverman, who is the founder and creator of the Nocturnists podcast. Post-Call drops on Fridays. Blood and Cancer drops every Thursday. Okay, let's get into the top stories in medical news. We begin today with a new study involving both human patients and mice that has confirmed a long-believed association between non-alcoholic fatty liver disease, NAFLD, and an alteration in the gut microbiome that produces high levels of alcohol. Researchers initiated this study after the treatment of a rare case. There was a patient who presented with severe non-alcoholic steatohepatitis, or NASH. The patient also had autobrewery syndrome. They had very high blood alcohol concentration, but an alcohol-free carbohydrate diet. It was determined that strains of high alcohol-producing Klebsiella pneumoniae rather than fungal infection were the catalyst for the high blood alcohol level. The researchers began by examining 43 patients with non-alcoholic fatty liver disease and 48 healthy control patients. 11 patients in the study group had non-alcoholic fatty liver disease and 32 had NASH. The researchers analyzed the gut microbiome. They found that an abundance of Klebsiella pneumoniae was slightly higher in patients with non-alcoholic fatty liver disease and was significantly stronger. Of the patients with non-alcoholic fatty liver disease, 61% carried high alcoholic and medium alcohol producing KPN, compared with about 6% of the controls. The authors noted certain design limitations, but they also said the causality was shown in their data by the transfer of experiments of high alcohol Klebsiella pneumoniae. You can find the correlated animal data in the story by clicking the link in the podcast notes. And secondary prevention of osteoporotic fractures is lacking despite being responsible for more hospitalizations of Americans than heart attacks, strokes, and breast cancer combined, and despite many fractures being preventable. This is according to new research from the National Osteoporotic Foundation. The report by independent firm Milliman examined the economic and clinical burden of new osteoporotic fractures in 2015 in the Medicare fee-for-service population, with data from large medical claims database. The report included an abundance of data on osteoporotic fractures, but the authors specifically called out a finding that showed lack of secondary prevention in people who had experienced a first osteoporotic fracture. They estimated that 15% of those who had a new osteoporotic fracture experienced one or more subsequent fractures within 12 months. Yet only 9% of women received a bone mineral density test within 6 months to evaluate them for osteoporosis. The authors report that 21% of individuals who had a new osteoporotic fracture underwent BMD testing during the fracture episode. The report estimated that preventing 5% of subsequent osteoporotic fractures could have saved the Medicare program $310 million just in the 2 or 3 years after a new fracture. They also found that preventing 20% of subsequent fractures could have saved $1.2 billion. These figures include the cost of additional bone mineral density testing, but did not account for the increased costs of treatment or fracture prevention. There is a link to the full report available in the story article online. And there is no association between sleep position during pregnancy and risk of adverse pregnancy outcomes such as stillbirth, small for gestational age newborns, and gestational hypertensive disorders. This is according to new research published in Obstetrics and Gynecology that followed 8,700 women over 4 years. Although case control studies have previously backed up concerns that right side or back sleeping can compress uterine blood vessels and decrease uterine blood flow, prospective analyses can counter the limitations of those data. Researchers in Salt Lake City conducted a multi-center observational cohort study of women with singleton gestations who completed 2 sleep questionnaires. The first questionnaire was between weeks 6 and 13, and the second between weeks 22 and 29. The researchers report finding no association between any adverse outcomes in sleep position at the first visit, with an odds ratio of 0.89 and 1.14. At mid-pregnancy, there was an association between non-left lateral sleeping and reduced risk of stillbirth. However, authors said that this observation is likely spurious, owing to small numbers of stillbirths. The Daily Medical News will be right back after this message. Welcome back to the Daily Medical News. I'm Nick Andrews. A coalition of health and nutrition experts say to introduce whole milk before low-fat or non-fat milk, avoid fruit juice or limit it to just a few sips per day, and also to stay away from, quote, toddler milk and chocolate milk entirely. The recommendations are based on the best available evidence, combined with sound expert judgment, and provide consistent messages. The experts say it is imperative to capitalize on early childhood as a critical window of opportunity when dietary patterns are both impressionable and capable of setting the stage for lifelong eating behaviors. The Academy of Nutrition and Dietetics, the American Academy of Pediatric Dentistry, the American Academy of Pediatrics, and the American Heart Association released their recommendations titled Healthy Beverage Consumption in Early Childhood in a report published earlier this month. The recommendations touch on various things, including breast milk or formula, drinking water, plain pasteurized milk, 100% juiced, plant-based milks, and non-dairy beverages, and, of course, other beverages. Dr. Lillian M. Beard is a clinical professor of pediatrics at George Washington University in D.C. She said that following these first-ever consensus recommendations on healthy drinks will alter family grocery shopping patterns. She said that it will also not only improve the overall health of children under 5 years old, but it can improve the health outcomes of everyone in the house. And finally today, combination therapy with Vildagliptin and metformin was associated with better and more durable glycemic control than metformin alone in patients with newly diagnosed type 2 diabetes. This is according to the results of the Verify study presented at the 2019 annual meeting of the European Association for the Study of Diabetes. Verify was a phase 4 randomized parallel group study designed to compare the durability of glycemic control achieved with a combination of Vildagliptin plus metformin or metformin alone in treatment-naive patients with type 2 diabetes. These results provide the first real evidence to support the use of combo therapy rather than the current standard of metformin alone in the initial treatment of type 2 diabetes. The researchers report that in all, about 2,000 patients from over 200 centers in 34 countries were included in the study. They were randomly assigned at 1-to-1 to receive either metformin with Vildagliptin or metformin alone. The study ran for 5 years, and treatment intensified if there was a loss of glycemic control at the discretion of the study investigators. First, Vildagliptin was added to patients taking metformin monotherapy, then insulin if needed. The researchers also report that there were no safety concerns. Adjudication and an independent data monitoring committee were set up after cardiovascular events occurred in a few patients. However, researchers stressed that this study was not a cardiovascular outcomes trial. Dr. Stefano Del Prato is a researcher at the University of Pisa in Italy. He said that there are twice as many patients retained under control with an early combination compared with monotherapy. He said that this means no more running after the patient losing control, but instead being proactive with a very low risk of hypoglycemia. The clinical implication is that there is now evidence for new combination therapy as an initial approach for managing type 2 diabetes. This study was funded by Novartis, and some of the physicians involved in the presentation of the data, including Dr. Del Prato, report some sort of financial relationship with Novartis. And that concludes this edition of the Daily Medical News. As always, you can find links to all of these stories in the show notes. We'll be back tomorrow at 4 a.m. Eastern Standard Time. For MD Edge, I'm Nick Andrews.